Hello. We have been talking for a while about the eQUITY platform, which is part of the project with Canada-wide impact support for health service managers. This free platform brings together validated and evidence-based tools, advice, and strategies in a single user-friendly place to support health, social, and or community service providers in implementing health services in French. I have with me Jacqueline Higgins, Director of Newfoundland and Labrador Francophone Health Network, who will share her experience using the platform eQUITY to support three different projects. Hello, Jacqueline.
Hi, how are you?
Good, thanks. Can you briefly describe these three projects? What were the objectives and what were you trying to achieve?
Sure. So I was first introduced to eQUITY Link during a project in collaboration with the provincial government of Newfoundland and Labrador and Eastern Health, which is our regional health authority. The goal was to develop and provide tools and resources for implementing bilingual services at Doorways, which is a walk-in mental health clinic service here in St. John's. So our goal was to eventually improve access to mental health services for the Francophone community of Newfoundland and Labrador. So I found the eQUITY Link platform to actually be very useful with the Doorways project. And I ended up using it for some of the tools and products that I developed in two other projects. So the first was a collaboration with Channel, which is a nonprofit organization that offers a warm line service through which people can actually talk to a trained mental health peer supporter. So the goal with that project was to launch a French warm line available to all Francophones across the province. The second project that I implemented this in with was in collaboration with Eastern Health to expand a pilot project on helping Francophones navigate the health system. So the objective was to provide the community with a navigator to answer questions and orient clients to the appropriate services, but also to educate Eastern Health employees and patients on the available French language services already existing at Eastern Health.
So three very different projects with different goals. Why have you chosen to use the eQUITY platform? What were you looking for in that platform to help the projects?
Well, I actually initially learned about the platform from one of our consultants, Joanne Chalifou, who's working with us on the Doorways project. The first thing that really caught my eye was the self-evaluation on the platform. So I'm relatively new to my position here at the Francophone Health Network, and the self-evaluation really helped me reflect on the elements and the steps that are required to implement a French service that is sustainable and actively offered. So by completing the evaluation as if I was Doorway services, I was able to properly reflect on what Eastern Health and Doorways already had in terms of knowledge and materials and resources. And this allowed us to more efficiently implement changes using documents or materials that were already available either through the network or at Eastern Health. So I completed the evaluation on my own, actually, for all three projects to help me gain perspective on what needed to be done and then prioritize the steps appropriately. So in this way, I was able to support the projects and partners by utilizing pre-existing resources, such as our free active offer training or some of our Hello Bonjour materials, which are to help identify bilingual professionals. So those were things that I didn't necessarily think about using in the beginning, and the platform helped me with that thought process. I also found that the 3.5-hour course, I believe it is, on the fundamentals also really helped me understand certain elements of the process in more detail. So it contained a lot of examples, actually, of communication plans, recruitment policies, things like that from other organizations and other provinces that helped sort of inspire some of the documents that we ended up creating for those projects, including actually our project plan for the navigation project with Eastern Health. In general, I'm also a very visual person. So the fact that you can take the self-evaluation and turn it into a progress report and then keep track of your work and that was really important to me to be able to visualize how far we've come. It also helped Joanne and I keep our stakeholders engaged and motivated by showing them the progress that we have made and what was left to do. So this platform is still relatively new, and I'm actively exploring the content on a regular basis and finding ways to kind of use elements from it into more of my projects and some of the networking that I'm doing as well. So those two aspects of the platform have been really helpful for me.
Your support role has been important in the tools' choice and their use. How would you describe this role?
So for all three projects, the Francophone Health Network has had a very active support role in guiding the partners through the process of implementing French language services. So this is still very new to a lot of the health services that currently exist in Newfoundland and Labrador. There aren't a lot of services currently existing here that are offered in French. So by using the platform, I feel that I was able to better explain the steps and inform our partners and working groups on the importance of certain elements and things that we really shouldn't skip in order to make sure that the service is sustainable and of good quality. So the fact that Joanne and I were able to really understand and use the platform in that way, we were able to create tools that we could adapt to the specificities of the project and of the geographic region, really. So these tools would not have otherwise been known to us or the partners for that matter. And I find that the implementation process is much simpler, in my opinion, with these resources. And we've had a lot of success with it so far. So we're now at the part that all three projects are really in a transition period. And partners are now starting to take charge of the efforts that we've been doing, and they're continuing to make improvements and implement more services and develop policies. And we've really started to slowly introduce the platform to some of those partners so that they can actually continue to benefit from the resources while continuing to implement the services and continue to reflect as well on how they can make those services more sustainable and accessible, even without the active support that the network's been offering so far. So it really helps with the sustainability of those projects.
Thank you for sharing your experience. I know you're taking part in the October 6th webinar, eQUITY Link, providing tools and support for the implementation of French language health services. In it, we'll see a demonstration of the platform and its resources. Also, you'll talk in more details of the Doorways project. This webinar will be on the SSF website soon after. Thanks again.
Thank you.